My name is Helen Singh. Currently, I am the Senior Nursing Officer for the Army Reserve. And in my civilian life, I am an advanced critical care practitioner working across the Edinburgh hospitals. So I joined the Army Reserve when I was a newly qualified nurse. So I was at 21 at the time. It was something I'd always been interested in, and I'd thought about doing my nurse training through the regular army. I'm so pleased I didn't. I think the Army Reserve life has been fantastic, and it's been given me the best of both worlds. So that's when I joined, so that's quite a lot of years ago. I did my nurse training in Edinburgh in NHS Lothian at the time, and I've worked across the country, mainly in Edinburgh, but I've also worked in London and worked out in Australia in my civilian role. I thought about the RAF and Navy, and I think it was probably opportunity. When I was doing my nurse training in the Royal Infirmary of Edinburgh at the time, one of my nurse tutors was in the Army Reserve, and she encouraged me to join the Army Reserve. And so I think sometimes things like that is just opportunities, people, but it has been a fantastic career. I think it's, when I trained, it's a lot different to how they train soldiers and officers now. It's basically was a 2-week training program at, it was at the time the QA College. It's significantly different now, but from there you developed your military skills by doing your 2 weeks annual camp, your drill nights. So you really developed your military skills and also your clinical skills working under canvas. And it was really fulfilling, really. Really enjoyed that clinical piece as well as the military piece, being able to go and do navigation exercise over the hills and things, and really getting your military skills up was a great opportunity. My first day, that was over 30 years ago, so it's a long time ago. Some of the highlights for me was doing things like military skills training, having a small team of people that we had to carry a stretcher across hills and do different kinds of command tasks, all that good military skills, and developing your teamwork, your resilience, and things like that. That was probably one of the highlights of my first years, many years ago. Really enjoyed the military skills. So as a reservist, you do get longer to prepare for deployment. So if there's any operations that are relatively short notice, the spearhead units would always be the regulars, because they are at a much shorter notice to move. So you will get time to plan and do additional training. So I'll take Afghanistan for an example, because that's one of the last big deployments that affected many reserves. First of all, Afghanistan was all voluntary, but the vast majority of people join the Army Reserve to deploy, and that's certainly a really high priority. People want to deploy. So the reserves do join voluntary unless it's very unusual, and that would be an act of parliament. So we volunteer to deploy, and then you'll get a lead-in time, because obviously you need to discuss that with your civilian employer, and that they need to be able to support the gapping if you go, and also the time you will potentially deploy slightly earlier so you can get any additional training done that's required before you go on operations. I've had an opportunity to deploy to Iraq and Afghanistan on the quite large, quite kinetic operations in both those centres. And I have to say it was an absolute privilege to deploy. I'll probably focus more on Afghanistan because that is the more recent deployment, albeit it's over 10 years ago now. So we deployed to Camp Bastion, and the way it worked is that there tended to be a regular hospital out for 6 months, then a reserve for 3 months, and then another reserve for 3 months, and then a regular or another nation sometimes. So we volunteered to deploy. We went as a formed unit. I went as the senior nursing officer for the hospital, and the hospital in Camp Bastion was an out-and-out trauma hospital. It was situated in the middle of the desert on a sort of slightly elevated plain. It was a huge place. It had all the logistics hub, and it had a hospital that had 10 ED bays, 4 theatres, theatre tables, up to 10 intensive care beds, and a ward that could expand up to 60 at maximum. It also had the laboratories, it had X-ray, it had a CT scanner, and we received Allied casualties, the vast majority being either UK or US. And gave life-saving surgery to them. We also obviously got local nationals as well, and the Afghan National Army. And the experience was an absolute privilege. Being able to look after those young lads and girls that put their lives on the line out patrolling was an absolute privilege. I cannot stress that enough. It was also probably the busiest time of my nursing career. We had multiple casualties, quite often a whole patrol coming in, or marketplace bombing. So you dealt with very kinetic, very significant injuries, which obviously needed a huge amount of teamwork, huge amount of planning. And it was a fantastic experience. And also you were able to take some of the things that you'd learnt back to your civilian employment. It's ironic, I was just in teaching yesterday, doing management of major incidents. So using exactly the same methods of teaching that we used in Afghanistan, or just before we went to Afghanistan, using tabletop and little counters and little people moving them around the board to talk through how you're going to deal with multiple casualty scenarios. Pandemic was an enormous challenge for everybody working in the NHS. It was an absolutely frightening experience, particularly at the start of the first wave, because people at that time, we didn't know what we were dealing with. We didn't know how it's going to affect them. We didn't know how many patients we were likely to get in. But I think being in the army, it gives you some very good principles. One of the things, and I was working with the management team in my critical care unit, and one of the things that I used to want to do is just go through what we call G1 to G9, look at your personnel, look at your operations, what's happening, look at your equipment, and have a very structured process to the challenges ahead. And I think that really helped. I think particularly on operations, if you're out in the middle of the desert, you're very focused on how much equipment you've got, when the next delivery is coming. So you really, it's instilled into you to look after your equipment really, really carefully, because that's all you've got. And that same principles apply to COVID pandemic. Is we had to be quite careful about PPE. Certainly at the start, in the first wave, we had everybody, the government was beavering away trying to get more PPE, but we had to be quite careful about how we managed it, how we utilised it, and not have people going in and out of the bubble, which was intensive care, was a big bubble of COVID patients. And I think the resilience, I've mentioned resilience a lot in the interview, but it gives you that resilience, it gives you that confidence. And it's funny how a lot of the staff started looking at you because you're in the army, so you know what to do. Well, we've not really been, although Sierra Leone and Ebola was something that the army did deal with, although I wasn't on that op, but the principles still apply. So it gives you sort of a set of principles that you can really hang your hat on, if you like. And I think the resilience is really important. I was really busy in the COVID pandemic. I was supporting my own unit, working many, many hours. I also got quite a late night phone call to help support the Louisa Jordan, which was a Nightingale hospital set up in Glasgow. So I went over there just to start setting up the intensive care unit for that, looking at all the supplies we'll need. And that purely I was selected for that because of my military background, sort of the understanding of what it's like to be running a kind of a field hospital, if you like, albeit in the centre of Glasgow or the centre of London. And that was the same across the piece. You'd find that quite a lot of the Nightingale hospitals, the people that were selected, pulled out of the NHS, were those that had a military background, a reservist background, particularly, as certainly the Nightingale in London had a lot of reserves in their planning team. Being an army reservist, one of the challenges is multitasking. You're balancing essentially two jobs, which can be quite hard going at times, trying to give your best to your civilian job and give your best to your army reserve job. And that has impacts obviously on family. I'm really fortunately, I've got a massively supportive husband and completely understands what I'm doing. So he understands when you go off on a 3, 4, 5 month deployment. So it's probably time management is the biggest challenge, fitting it all in. Proud moments, probably one of the proudest moments of my military career was being awarded an MBE. That was post-Afghanistan. I was the senior nursing officer of the hospital there. And it was 2010, it was one of the busiest and most kinetic periods of that time. And I was awarded the MBE for clinical leadership, and also some of the work I'd done in Scotland with employer support, and some of that work was relating to getting 2 weeks paid leave for reservists in Scotland. But all of that, in my view, I was very fortunate, but it was actually the team effort that both for both Mary Seacole and Florence Nightingale, to me, they're absolute role models for army nursing. They've worked in some of the most challenging environments, and I think we've sometimes working in quite challenging environments nowadays, I can only imagine what they went through in the time that they've been working in the Crimea, etc. But throughout that time, they were resilient, they were robust, and they kept their standards. And those standards are an absolute legacy, because Florence Nightingale, with her hygiene, she was a woman before her time, and recognised the importance of that. So keeping those standards, keeping those principles, and being absolute superb role models, they're fantastic individuals. It's a privilege. It's a privilege to be able to serve your country, and it's a privilege to have the opportunity to care for our soldiers that do go out every day and put their lives on the line for their country.